Hi everyone. Good morning, good afternoon, and evening, depending on your time zone. I am Nurse ID. Welcome to my YouTube channel. Please do not forget to subscribe to my channel so as to get notification each time I come on. I want to talk about fasting lipid profile. Please don't leave. It's not only for medical students. Any presentation I make here is for everybody. Are you up to the age of 40 and you don't know your fasting lipid profile? It is very necessary. In fact, it's advisable for me 35. It depends on one's eating habits. Someone that takes in so much fat and oil and so on, is good you even do it early from 35, because recently I've nursed a patient of 38 years who had stroke due to high cholesterol. See, high cholesterol can kill. Yeah, it can kill. So it's very necessary that you know your cholesterol level. So that's why I implore every one of us to check our cholesterol level from the age of 35. So what are the normal value of total cholesterol? Total cholesterol should be less than 200 milligram per dl, or less than 5.2 millimole per liter. For triglyceride, it should be less than 180.0 milligram per dl, or less than 2.0 millimole per liter. For HDL, which is known as the high density lipoprotein, that is the good cholesterol, good one, HDL. It should be above 40 milligram per dl and above is perfect. Below is means is on the low side, is bad. So it should be 40 and above. Then or for millimole per liter, it should be above 1.0. Then for the LDL, which is the low density lipoprotein, which is the bad cholesterol, HDL the good cholesterol, LDL the bad cholesterol. So the LDL should be less than 120 milligram per dl, or less than 3.0 millimole per liter. We also have one known as the VLDL, very low density lipoprotein. You can see that the low ones are the bad ones. That's the trick. That was how, when I was studying for NCLEX, that was how I used to know. The low ones are the bad ones, while the high ones, the high one is the good one. So high density lipoprotein, good cholesterol. Low density lipoprotein, bad cholesterol. So for the VLDL, which is the bad cholesterol, it ranges from 14.00 to 34.00 milligram per dl, though it depends on calibration that is used for the test. So what are the symptoms? Those figures are very important to put in your head as an NCLEX student, but for a layman, you may also put it in your head. It's still necessary, but you don't need to bother, because the results comes with the normal value by the side. Yes. So when you look at your own value, you look at the normal value, you will use and differentiate. So what are the symptoms of high cholesterol? Shortness of breath, difficulty in breathing, palpitation, high blood pressure, tightness in the chest. Tightness in the chest. Palpitation, your heart will beat. From time to time, you hear your heart beat very fast and stop. That's palpitation. Then severe headache. Someone that is always complaining of severe headache should check the cholesterol level. Then heavy heartbeat. So persistent headache is not something you should joke with. Yes, you should check. Is either one of the bad cholesterol is high? Is either the LDL or the VLDL? That's the low density lipoprotein, the LDL, or the very low density lipoprotein, the VLDL, is high. So in that case, you see your doctor, take the medications you'll be given. If it's very high, they can give you a drugs to break the fat, or you can be advised to change your lifestyle. Whatever you'll be eating, too much oil, too much fatty foods is not necessary. Then excess intake of carbohydrate too can cause someone to have a high cholesterol, so you avoid them. So then also one of the symptoms is weakness on one side of the body, like stroke-like symptom. Yes, high cholesterol can cause stroke-like symptoms. You will be having weakness on one side of the face, even twitching, the face twitching to one side, weakness of the arm, and so on and so forth. So it is very important that you go for your checkup. Then what are the foods that are low and high in cholesterol? Like skim milk is low in cholesterol. Oats are very good too. Fruits and vegetables, nuts are very good. Beans and so on. Like fruits like apple, grapes, citrus, they are very good. They are very good. Then if you are the type that doesn't take grapes like me, I don't take grapes because I don't really fancy it, but I take fruits. It's also help. So what are the foods that are high in cholesterol? Full fat dairy, baked foods, palm oil is also high in cholesterol, butter, red meat, pork, and lamb, and so on. So for people with high cholesterol, they need lifestyle changes. If your result comes and your result is very close to the ceiling, we have ranges, the lowest and the highest. So if your own is close to the highest, you need changes lifestyle changes like exercising, avoid sitting too much because sedentary lifestyle will make you add weight. Avoid eating too much carbohydrates. Yeah, it will make you accumulate so much fat. Then also eat healthy foods like increasing fruits and vegetables in your diet. If your own is on the high side, you can switch from full cream milk to skimmed milk, which contains like 1 to 3% of fat. You can see it's very low. So there are a lot of things you can do to help yourself. Remember, health is wealth. Thank you so much for your time. Do not forget to give me thumbs up and subscribe to my channel to get notification each time I post a new video. Thank you. I also have a YouTube shorts. That one is more fun. I still give some health tips too. But please subscribe to my channel. Thank you so much.